Epilepsy is one of the chronic conditions when there is abnormal brain activity in part of the brain. Now, our brain cells are fired excessively. They create abnormal activity and discharge, and that presents in different clinical forms. The seizure may depend which part of the brain it's coming from. Traditionally, people think of seizures having a grand mal or twitching in all body extremities, but if it's a part of brain involved, it may look like a spacing out spell, lip twitching, and a grand mal seizure is a twitching in all extremities as we know of. Epilepsy is diagnosed initially with a clinical suspicion or the symptoms. Secondly, there are testing that we can do, including a brainwave testing called EEG to diagnose the seizures. We have a very robust outpatient clinical practice for diagnosis of epilepsy. We bring the patient into our clinic, we do the testing called EEG, and in some people who may need to be admitted to the hospital for a long-term EEG monitoring, we hook them with the EEG leads and have them stay in a hospital for 2, 3, or 4 days to capture these episodes. Once the episodes are confirmed, and then we start the patient on the medication treatment afterwards. We have a very robust outpatient practice. We deal with patients with chronic epilepsy, and most patients do benefit from the medication for epilepsy. And some people who have a complicated or intractable epilepsy that cannot be controlled with medication, we bring them in here. And now with the advent of devices, we can put these neuromodulation devices called vagus nerve stimulator that goes in your chest here, the device that can go in your scalp called RNS, or in some people we can also do a surgery in the brain for epilepsy that can potentially cure the seizures.